the title. I'm editor for Pig Progress, and my name is Vincent de Beek. I've been editor for this for roughly 17 years already. I will be the host for this webinar, for the seminar, for the next 45 minutes. I won't do that alone, because with me I also have Dr. Sandra Smith of Arm & Hammer, and also Dr. Jessica Seat of Animal Science Products. They will give both presentations of roughly 17 minutes each, after which there will be room for questions and answers. Before we go into that session, a few words about antibiotic reduction. And as this, we published an article in Pig Progress end of last year about the international monitoring of antibiotic reduction, because mainly in Europe, antibiotic reduction has been a very serious subject. Now, one country reduces antibiotics using method A, another country does it using method B, with the result that we cannot compare between countries who is doing best with antibiotic reduction. So this article spends attention to that, and it made me think that how is that in Asia? Do we know how Asian countries perform relatively to another in terms of antibiotic reduction and antibiotic use? Well, this is why I asked a couple of veterinary experts throughout Asia to give their impressions. So this is not scientific, this is just an impression. I asked them, how important for you is antibiotic reduction in 2023? After all, I can imagine that in times of COVID, African swine fever and inflation, perhaps for some, antibiotic reduction may not be as important as it should be. So I asked that, and I'm happy to tell you that in all countries that I asked, my veterinary contacts said, yes, it is still very important. A second question I asked is, what are the 3 main antibiotics used in your country according to your impression? This is the answers that I got. And there's 2 things I'd like to highlight from that. The amoxicillin comes back in virtually all countries. And also you see with the Philippines, for instance, colistin and ceftiofur being used, 2 antibiotics that are being considered as antibiotics of last resort. So there is definitely some work to be done. And last question I asked them as well, what is the number strategy you would recommend to make sure that farmers would reduce their antibiotics? Well, these are the answers that I received. 2 of them focus on diagnosis, 1 focuses on farm management, and the last one, very aptly, focuses on education, the importance about the why and the how. And I think that is exactly what we're going to do today. So that's a nice bridge to introduce you to the first speaker. I would like to thank my contacts for giving their input. And I would like to go to the first speaker, and that is Dr. Sandra Smith. Let's go to the right page. She's Director of Innovation and Product Development at Arm & Hammer Animal Food Production, and she shall focus on gut problems and how to manage to find solutions to reduce antibiotics and yet overcome the gut problems. Give my warm welcome to Sandra. Good luck.
Bedankt. Well, thank you very much for the introduction. So I'm going to be talking about the strategies that we use to reduce antibiotic use on farm. So the first slide I wanted to show you is just what happened in 2017 when the USA reduced its use of medically important antimicrobials. And so in swine and in other livestock species as well, there was an immediate reduction of antibiotics that were used. Then it did kind of come up again. And as Vin said, there are different countries that have also reduced antibiotic use. And I know in Denmark as well, there was an immediate reduction when antibiotic growth promoters were taken out. But then slowly it's been creeping up over time again. So what is the risk of taking the antibiotics out of the diets? What's that going to do to the animals? I mean, as you know, most of these livestock has been using antibiotics for the last 60, 70 years. And so what happened in Denmark is that the risk of antibiotic treatment increased. And there were diseases that came up, which I call sort of re-emerging diseases. So Lawsonia intracellularis, which causes diarrhea in pigs, came up in Denmark when they reduced antibiotic growth promoters. So if you are going to get more disease issues if you take antibiotic growth promoters out, what are some of the options that you have? A review paper that if you are going to go up antibiotic-free, what should producers be looking at? So the first thing is try and make sure your pig herd is free of PRRS. But then the one that I'm actually going to be talking about is the second one, strategic adoption of non-antibiotic feed additives. But notice the last 3 words, proven to be effective, the last 4 words. Then there's also look at biosecurity. That's really important. Have a well-designed vaccination program, minimize social stress on the pigs, make sure your barn environment is of high quality, feed formulation is always really important, and then one that I think is really important and we'll be talking about a little bit more is high level of perinatal care of the sow and her offspring so that you have healthy pigs at weaning. So when the veterinary directive took place in the United States, there was a survey done the next year on some of these swine farmers to say, well, what did you actually do? And about 60%, let's see if I can point, about 60% eliminated all uses of antibiotics for growth promotion. Then there was another 17% that reduced the use, and then others that moved to non-medically important growth promoters. But the majority of swine farmers actually stopped using antibiotics as growth promoters. And the top things that they did to prepare for that, the changes they made, was increase vaccinations, so to try and reduce diseases that way. And then the second was increase the non-antibiotic feed additives. And really that's what we do at Arm & Hammer. We produce these antibiotic feed additives to improve the intestinal health of livestock. So in this particular case, we look at a 3-pillar strategy because there's not one product that's going to really be able to handle all the issues. So pillar 1, which I think is the most important, is early microbial succession. If you get the good bacteria in there, the right bacteria in these animals really early on, you'll get good microbial succession, you'll get a healthy pig, you'll get a healthy gut, you'll get good an immune system being developed. Pillar 2 is improve the immune status of the animal. And pillar 3 is target specific bacterial pathogens. I'm actually going to start with pillar 2, even though I think pillar 1 is the most important, and I'm going to get back to that one. So for the immune system modulation, we have a product called CELMANAX. So CELMANAX is a postbiotic and a prebiotic. It contains what we call refined functional carbohydrates. So it's actually yeast cell walls that have been enzymatically hydrolyzed. So you might ask, well, how is CELMANAX any different from other yeast cell wall products? So what we have here is different products. So we have our CELMANAX, our AMAX, and then we have, 4 other products. And we looked at the fractions, the yeast cell wall fractions. So when it's been enzymatically hydrolyzed, I don't know if you can notice, but what we're missing is the smaller fraction. So the smaller fractions are monomers and dimers of sugars that are released in other hydrolysis of yeast cell walls, but in the enzymatic hydrolysis, you don't get those smaller fractions, the monomers and dimers of the sugars. What you have instead is more of the bioactive components. And what do those bioactive components actually do? Well, if you look at RFCs, there are a lot of different modes of action. And if I had more than the 17 minutes I'd been given, I could go into some of those, but I don't have that time. So we know that they affect some of the good bacteria, the microbiota. We know that they can bind E. coli and salmonella. We know that they can affect the innate immune system. What I'll be showing you today is some of what happens with the adaptive immune system. So here's just a quick study we did to show you that when we're feeding CELMANAX to pigs, we do affect the immune system. Quick and easy way to show this is to actually cause an immune response in the animal. So this was done by adding LPS. So LPS is lipopolysaccharide from gram-negative bacteria. when an animal gets exposed to LPS, there's an immune response. And so the easiest way to see that is a temperature increase. So in these nursery piglets, or pigs, there was an immediate spike when they got the LPS. So it wasn't an actual infection, it was just part of the bacteria. But then the piglets that were on the CELMANAX, that it dropped fairly quickly. This was 2 hours and 4 hours after the post-injection. So this is just to indicate that, yes, when you're adding CELMANAX, you have an immune response. But I told you I was going to tell you about immunoglobulins. When you look at the milk of sows that are on CELMANAX, you get improvements in some of the components of the milk. So the fat, the protein, lactose, energy, both in early lactation and in late lactation. But what was significant was immunoglobulins in the colostrum. So the adaptive immune system of the sow is more active, and these immunoglobulins are going into the milk and going into the piglets. And so we had IgG in the colostrum. Even later, during early and late lactation, IgA in the milk was higher, and so was the IgM in the colostrum and the milk. But does that actually, just because you've got these extra immunoglobulins in the milk, does that really affect the piglets? This was a trial that we did on a sow farm where we had a side-by-side on a farm. And again, the sows were fed the CELMANAX, but just 5 days before farrowing. So they'd only been fed it for 5 days, and yet we had an increase in colostrum in the sows that were getting the CELMANAX. But the most important thing really was the health status of the animals. So there were more healthy sows. So 67% of the sows getting the CELMANAX did not get any antibiotic treatments. So here we have reduction in antibiotic use. And then the litters themselves. Now remember, the sows were getting the product, not the piglets. But less litters were treated for medical issues with antibiotics. Okay, so that takes us to pillar 3. So now we're targeting specific bacterial pathogens in the animals or on the farm. I'll give you guys a few seconds to look at this, find your favorite country, and see what the main swine diseases are in the country of interest. And this was done this is from 2016, I think 2006 to 2016. So if you just look at those countries and the diseases that are predominant in those countries, you can see they're not the same. This is why one-size-fits-all approach does not work to try and treat swine, or try and treat any animal, actually. One thing that does seem to be in common amongst most of them are E. coli diseases. But if anyone knows bacteria, E. coli is not E. coli is not E. coli. E. coli's got this whole range of acronyms. You've got EHEC, you've got ETEC, you've got APEC, and that all refers to whether it produces a toxin. So if it's like the F18 E. coli, it could be producing sugar toxin, and you're going to get diarrhea in the piglets. You could also get intrainvasive E. coli, and that actually gets through the gastrointestinal tract and you get a systemic infection in those pigs. So just because E. coli is written here and it's all over the world, it doesn't mean to say it's the same E. coli. So for this targeted pathogen approach, we have a range of products sort of targeted to specific pathogens. They're customized solutions. It's called Certillis. And we can address the specific challenges in your region, on your farm, with our proprietary bacillus strains. So we go on farm, do a microbial terroir assessment, see what pathogens are present, what the diversity of the pathogens are, and then find a solution that's right for that particular problem that the farm's experiencing. So this is my simplified example of how that works. So this is a dendrogram of particular pathogens. The length of the lines indicates how related they are. So the longer the line, the less related they are to the ones next to it. So this group here, these ones are all really, really closely related. But then we have these colors. These colors represent our bacillus that will inhibit that particular clade of pathogen. So just a quick look at this graph. I'd say we should definitely choose this blue bacillus for this particular farm. But you've also got to think of what the actual E. coli or Clostridia or whatever pathogen it is, are they actually causing clinical disease? So some of these that are highlighted in bold are ones that we actually got from from animals that had clinical signs of disease. So you really want to be capturing those as well. So in this case, we'd probably take this brick red bacillus as well and make our solution for this farm with the 2 strains of bacillus, the blue one and the red one. And when we do that on farm, our formulations, when we go back after 6 months, our formulations do decrease the level of the swine pathogens. So in this particular case, we've got a significant reduction from baseline to the sows fed Certillus. Now remember, we're only feeding it to the sows, and yet look at this reduction that we got in the piglets. We've got a significant reduction in the piglets because the sows, one, were healthier, and the sows were shedding less E. coli into the environment. Now, the advantage of being able to, select which bacillus strains we put together is we can reformulate when needed. So in this particular case, we had a farm that was on a competitor product. We went in, we sampled, we selected some strains to put on farm. We went back 6 months later. We did see a reduction in E. coli, but we also noticed that the diversity of the strains had changed. So they were still E. coli, but their genetic makeup had changed enough that we then went and selected a different set of bacillus strains, and we went back after 6 months, and we got a greater reduction of E. coli on that farm. So now we get to pillar 1, which is my favorite pillar. This is early microbial succession. I believe that what happens in, whether it's a bird, whether it's a piglet, or whether it's a calf, those first hours are really, really important to set up a really good microbial succession, set up the gut microbiome so that you've got a healthy pig right throughout its life. So if we talk about the role of priority effects, if whatever first bacterial species arrives, if the host is going to decide what's in the gut, it doesn't matter if the first species that arrives is a yellow species, you're going to end up with a blue gut. So in this case, if the blue one gets there first, it doesn't matter if you get other bacteria coming in later, you're going to get a blue gut. Now, I'm not saying that if you start off a swine with soil bacteria, that succession's not going to occur and it's not going to become a host-associated microbiome. It is. Obviously, the environment within the gut will decide which bacteria stay there, which ones thrive. But the starting point, and we've done enough studies now to know, whatever you start off with affects how that microbial succession occurs in the animal, whether that's chickens, or whether it's swine, or whether it's calves. And this is really important. Whatever you end up with here, you're going to have different metabolites, different immune activation. So it's really, really important to get the right bacteria in there to begin with. So most of our swine studies, we're not actually treating the piglets. And that's one the advantage of piglets. They actually stay with the sow. They stay with their mother. You get vertical transmission from the mother to the piglets. You don't get that with chicks, and you don't get that with dairy calves. So this is just a summary of some of our CELMANAX data, where we fed the CELMANAX to the sows, and then we either measured the piglet birth weight or the piglet wean weight, and sometimes both. But in most of the cases, the piglets were healthier, and you can see this based on average daily gain, or the growth weight of the pigs. Both wean and at the birth weight was higher if the sows were on CELMANAX. And I highlighted some of these in where we had both the birth weight and the wean weight were significantly higher. So that just shows that, if you treat the sow, you're going to get healthy piglets. We have very similar results when we look at our Certillus fed sows. So in this case, We actually took fecal samples from the piglets 3 days post-wean, and we looked at the microbiota. And I'm just showing you some of the data here, but we had our fecal lactic acid bacteria count. So lactic acid bacteria, that would be lactobacillus, lactococcus. Those are the bacteria that you find in the small intestine associated with health in the animal. They were significantly higher in piglets that came from Sotilis-fed sows. The other thing we looked at was acid 1 alpha glycoprotein. So this is a serum biomarker that kind of indicates sort of immune stress in an animal. So the lower it is, the better it is for the animal, and the more it can actually just focus on growth and just being healthy instead of being stressed. So at weaning, that's a stressful time in the piglet's life. So we had we've got higher alpha-1 acid glycoprotein, but every time it was trends. But the piglets from Sotilis-fed sows had reduced stress markers in their blood. And this also then translated into growth. So at phase 1, we had significantly higher body weight in the piglets from Sotilis-fed sows, and that carried through to day 51, phases 1 through 4. And I think my time's up, because one stood up. So those are the 3 pillars that we focus on. So if anyone wants to come visit the booth to get more information, we have a QR code too if you want more information on our products.
Thank you very much, and join me in giving a big round of applause to Sandra. Thank you very much. Is there anybody in the audience who has a question? In that case, I have a question for you. Obviously, you mentioned that why it is good to feed the sows, and that the effect will trickle through the piglets. Has it been tested on piglets directly as well, I wonder?
Well, I don't know. Have we fed CELMANAX to piglets? They're still on the sow, so they're being fed on the sow.
Yeah.
We have done some where we've kind of sprayed the udder with bacteria and stuff.
For instance, but also in post-weaning feed, for instance.
But yes, we've done post-weaning feed in the nursery feed and stuff. We've done that as well. Yes.
Yeah.
Yes. No, we'll feed in the nursery. It's just when they're still on the sow, it's just a little harder. But
I see.
But we are working with ASP to work on that, so it's good collaboration here, having both of us.
I'm looking in the audience. Anybody else with a question? $1 million question: will we ever be able to remove antibiotics altogether from swine production?
So that would be nice to remove antibiotics, but we are going to keep getting diseases, and bacteria are going to keep, evolving and causing problems. I think we can get away from antibiotic growth promoters. I don't think we need those, but if there's an actual disease outbreak, you do want to be able to treat the animals. I do think we could probably get away from treating like the whole herd and be more, specific about which animals we treat.
Yeah.
Something else that I'd like to work on, or that we are working on anyway, is being able to predict when a disease outbreak is going to occur, so you can start treating without antibiotics or treat with less antibiotics before disease outbreak occurs.
That makes sense. I think experience from Europe tells us that when management is top-notch, when biosecurity is top-notch, when you have the right genetics and all the packages work, the right nutrition, then antibiotics can be reduced quite far.
Quite effectively, yes.
Thank you again for your excellent presentation.
Thank you.
And that brings me to today's second speaker, and it's Dr. Jessica Seat. She's Director of Veterinary Science at Animal Science Products, also based in the US. And her focus will mostly be on the respiratory side of things. So we're talking about lung health here. For instance, infections caused by influenza and Pasteurella multocida. She introduces guaifenesin as a method to help pigs overcome respiratory problems. There you are. Go for it. Thank you very much and welcome.
Thank you.
Well done. Yeah.
Okay, so thank you all for being here today and for participating in our seminar. Zander did an excellent job of looking at non-antibiotic interventions for enteric. And like Vincent mentioned, I will be focusing more on the respiratory side. So I will be introducing to you today some work we've done at Animal Science Products using our product called Mucosal, which is a guaifenesin-based expectorant, in terms of a efficacy trial looking at a co-challenge with H1N1 influenza as well as Pasteurella matosida. So as we know right now, especially in the swine world, we are in the process of having our respiratory outbreaks. This is the prime time. We're seeing numerous PRRS outbreaks this year. Talking with my Asian colleagues, they were seeing it also more towards December, November. And so we are in the midst of respiratory challenge, influenza, PRRS virus, etc. So when we have that, we often see a non-productive cough in the barn. We see that congestion. So we know that mucus is going to be there. It's going to be in the airways. It is required to trap those particles or those pathogens, but it's also important to expel and essentially clear those particles from the respiratory tract. So with our product, essentially, when we see these kind of congested barns, this non-productive cough, we know that some of the bacteria and viruses that are present can cause an excessive mucus production secretion as well as decrease the ciliary movement and clearance of those particles. And so when that happens, it's important in swine that we get in front of that. And so therapeutic intervention in the pathophysiology of that airway hyper secretion is going to be important, and that's where Mucosal comes into play. So people have historically used expectorants to sorry, I'm going to go back one. Sorry. So people have historically used expectorants to help loosen that mucus, making the mucociliary escalator more effective and the cough more productive. And so more recently, we have seen that the gummaguanac has been approved in Europe and also in the US as a food additive, and it's been synthesized. Where did my screen go? Sorry. Okay, here we are. So as I mentioned, it's become a food additive that's been refined and synthesized as guaifenesin, and it's present in our product at ASP known as Mucosal. And as you saw on the previous slide, it is a water miscible syrup where it will have the most concentrated form of guaifenesin present. And so again, as I've mentioned, it really will also overcome that insolubility that we've seen with powder forms of guaifenesin in the past. And so it's going to make it a little bit more easier for producers to use in the swine barns. And as you can see here, there is a paper that I highly recommend. I'm not going to spend a lot of time on it due to time limitations, but it's by Seagrave et al. That researcher actually did an in vitro study where they used human respiratory cells. They essentially irritated those cells with particles, and then they looked at the mucin as well as the ciliary movement of those cells. It was a very fascinating study. Here's just one slide looking at that ciliary movement. I highly recommend that you go back and read that literature paper. It was just a great paper to really look at the in vitro side, and it really gave us our ambition to then go into the in vivo side and look at swine. And so I'm going to jump ahead to be able to do that. And these other slides are really just going through that paper. So again, I highly recommend you take a look at that. And so as I mentioned, because of the work that Seagrave et al. Did, it really we wanted to look at that in the field and bring it into swine and know more. And so with the help of Lechtenberg et al. In Nebraska, we were able to do an in vivo study in swine with a challenge of H1N1 influenza, but also we were looking at Pasteurella matosida. So we were getting that code challenge. And that is common of what we would see in the swine industry, especially in the US. And so we call that a porcine respiratory disease complex. So we wanted to make sure that we had something that was representative of what you would see in the field. So in this study, we had 25 3 to 4 week old piglets that were crossbred, mixed gendered, and they were confirmed to be influenza negative. There was no history of influenza or Pasteurella matosida vaccination. With the 20 of the 25 pigs, they were challenged. The primary infection was an intranasal dose of H1N1 influenza, and then that was given at day 0. And at day 3, we came back with a secondary challenge, which was Pasteurella matosida, also given intranasal. So with this kind of model, that was the model given from Kelly Lechtenberg et al., we will normally see clinical signs of the model appear 1 to 3 days after the influenza challenge. The treatment group in this study did receive 7.4 mils of our Mucosol product per gallon of water, and that started at day 2 when symptoms started to appear. It was continued every day until the end of the study. Now, the placebo group only received water, and then again, both treatments continued until all pigs were euthanized at day 8. So in this study, we were looking at average respiratory scores, nasal secretion scores, depression scores, and rectal temperatures, and that was daily from day 0 to day 8. It is important to note that the pigs did not receive any antimicrobial treatment 14 days prior to the study. I also want to reiterate that with influenza, it is an extremely important pathogen in swine, as it has the ability to reassort. As we know, pigs are susceptible to human and avian strains, and so that leaves them open for that open reassortment. So in this study, as well, again, that's the guaifenesin product, was able to reduce pyrexia very quickly. So as you can see here in this trial, 1 day post-influenza is when we see that peak in, and then also 2 days post the Pasteurella. And so the clinical scoring and rectal temperatures, they started pre-challenge, and we continued until euthanasia at day 8. You see that most of them trended very similar in both groups, but it was the placebo group that was not able to drop that rectal temperature as quickly as the Mucosol group post the influenza challenge. As you can see here, it actually had another peak post-influenza challenge, whereas the guaifenesin group was able to maintain that 103.3 temperature throughout the influenza prior to the Pasteurella. Mucosol also resulted in less depression. So both groups, as we can see, had elevations in average depression scores on day 1, post the influenza challenge, and then day 4, which was 1 day post the Pasteurella challenge. The guaifenesin treated group showed a continual reduction in average depression scores towards the end of the study, and that actually was significant by day 8. We also look at nasal secretion during our study, and those scores were generally lower in the guaifenesin, so the Mucosol group, than the placebo. Both groups had a significant increase in nasal secretions, as we can see here on days 1 and 2 post the influenza challenge, and then also day 4, 1 day post the Pasteurella challenge. The Mucosol treated group did reach off very quickly, and it continued to resolve nasal secretions by the end of the study, and that was significant by day 8. We also saw improvement in the respiratory scores for the Mucosol treated group compared to the placebo. Both groups responded with a peak in respiratory scores, as we can see here post the influenza challenge, and then here also post the Pasteurella challenge. And there was a statistical significant difference on day 3 after the influenza challenge compared from the Mucosol group to the placebo group. And then also we saw that drop in the respiratory scores post the Pasteurella challenge, and that was significant by day 8. We also, around day 8 necropsy, we were looking at individual lung globes, and so we were evaluating the amount of consolidation, as you can see here on the screen. So it's important to see that we're looking for that demarcation, so the kind of darker purple area. That's where we know that we're going to be looking for our viral and bacterial pathogens. it was important to also understand that it can spread through the different diaphragmatic lobes. That's what we're going to be looking at in terms of influenza. But remember, this was a co-challenge with bacteria. And so again, that porcine respiratory disease complex. And so it will give you maybe a different, more mottled appearance versus a checkered board appearance. But overall, the average influenza lung score was higher in the placebo group than it was in the mucosal group, which you can see here in figure 6. And then also in the placebo group for the Pasteurella, the lung lesions were a lot higher than compared to the mucosal group, which you can see in figure 5 here. And then overall, looking at the total lung lesion scores, we saw an elevation in the placebo compared to that mucosal group. And so overall, we did see that reduction in lung consolidation when using that guaifenesin to treat the respiratory disease versus a viral and a bacterial pathogen. So in conclusion, this study really demonstrated some significant effects of guaifenesin at diminishing certain clinical parameters associated with a porcine respiratory disease complex. So again, that viral and bacterial co-pathogens. Mucosal was able to reduce the mucus volume and thin the phlegm in the airways. It improves the inefficient breathing that occurs in the barn due to poor air quality. So mucosal will be pulling water into the respiratory tract. It lubricates and stimulates the flow of the secretions while also allowing that cilia to really carry irritants up and generating a productive cough. It also thins the mucus and then promotes that reflex of coughing and sneezing, and so there we get more of an efficient cough as well. And so with mucosal, simply what we were doing was making that cough more productive in those pigs. We were expelling disease, all the while doing this with no antibiotics. And with that, I will take any questions. Thank you.
Very much, Dr. Seed. Excellent presentation. I'm looking to the audience again. Is there any question from you at all? And if not,
Yes.
Guaifenesin.
Yes.
Interesting concept. Could you explain a little bit about the mode of action of this compound?
Right. Yep.
Yeah.
So guaifenesin as an expectorant, we're looking at the mode of action as being where we're thinning that mucus layer. We're also stimulating that cilia movement to expel the mucus out of the airways. So that's kind of what, with that product, with guaifenesin, that's what we're seeing in terms of mode of action and how we can be productive at expelling that congestion and that mucus from plugging the airways.
Mm-hmm. Where does it come from, guaifenesin? What is it kind of?
So it's again, so as I mentioned in the other slide, it's the guaiacanac, and so they've been able to synthesize and create this newer product, guaifenesin, which with our product, it is a food grade, generally recognized as safe product. So it is safe to use in your pigs. It will, and for even human consumption. But so it will be a safe product that you can use in swine, and you do not have to worry about downstream any kind of issues like that. So.
I see.
Yep.
Thank you for that. I'm looking at the audience again. Any questions in the meantime? There we go. Wait a minute. I'll have a microphone for you.
Is mucosal specific only for pigs or other animals?
Great question. So the question was, is it specific for just pigs? Absolutely not. We actually use this product as well in poultry. We often will use it in the turkey barns during respiratory disease. We do also carry another product at Animal Science product called Unisol, which is sodium salicylate. And so it is a great combination in terms of respiratory disease in swine, in poultry, in cattle to combat respiratory diseases. So we're able to also address the inflammation side as well as the congestion side. And so absolutely we do use mucosal in poultry. It's probably less likely used in cattle due to the fact that it's more of a sedation for guaifenesin versus an expectorant. But the Unisol side, the sodium salicylate can be used in cattle and would help more with the inflammatory aspect. So thank you.
Thank you very much.
Yep.
And I think we'll conclude it at that. Thank you very much for your... Right. We have Okay. Before I wrap it up, I would like to say that we've had 2 fantastic stories and explanations how antibiotics can be further removed in animal production. I hope they've been inspiring you and have been giving you some ideas how to move on with that topic. Before I close off, I would like to let you know that in case you would like to attend more of Big Progress seminars, we will continue in Hall Jupiter number 5, just down the road. And there we shall talk about gut health, and that starts at 1 o'clock. So I don't have any break, and you will have only 15 minutes, but then you can join as well. Warmly recommended. For now, I would like to thank you for being present. I'd like to thank Dr. Smith and Dr. Seed for their excellent presentation. I'd like to thank the audience at a distance for being with us, and I hope to see you all soon. Thank you very much.